Hi, I am Dr. Abhinandan Reddy, consultant endoscopic and complex spine surgeon. There is a lot of misinformation going around endoscopic spine surgery. In this video, let's burst some myths regarding endoscopic spine surgery. A lot of people say that endoscopic spine surgery is new, experimental, and most of the surgeons are not trained. This is a myth because endoscopic spine surgery has been in place for almost like 25 to 30 years now. With the advancing technologies, the endoscopic spine surgery has also advanced. Before, traditional open surgery was the gold standard. Later, microscopic surgeries have become the gold standard. Soon, endoscopic spine surgery will be the gold standard. As we are advancing through the technology, the scope size, the camera system, and the visual field have been improving day by day. So the scope of endoscopic spine surgery has increased, and also people are trained for endoscopic spine surgeries at various levels of their training programs. So most of the surgeons today are trying to get trained in endoscopic spine surgeries. Today, endoscopic spine surgery is completely evidence-based and established spine surgery. Most of the countries around the world are pursuing endoscopic spine surgery for simple spine surgeries. People often say that through a small opening, probably the surgeon may not be able to see or visualize the entire field. The results might be compromising. Or people may feel the incision is small, the result may be small too, but this is not a fact, because in endoscopic spine surgery, though we are operating through a small hole, because of the enhanced camera system, the visual field is completely magnified, and with the saline irrigation we can easily make out the nerves, the disc, and the surrounding tissues which are compressing the nerves. We can go around the nerves to every nook and corner with the endoscope and the endoscopic instruments, and we can clear the nerves completely with minimal damage to the muscles, bones, and even the nerves. So we can see every nook and corner of the tissues, underneath the nerve, beyond the nerve, to the opposite side of the nerve. So we can completely free the nerve using endoscopic spine surgery, which is sometimes impossible with a naked eye in the traditional open spine surgery. Usually people say that endoscopic spine surgery is for only small spine problems. No, this is a myth, because in today's technology we can solve many of the spine problems using endoscopic spine surgery. Let's say it started with simple discectomy, now it has advanced to decompressions and also fusions. So we can do multiple levels of discectomies, multiple levels of decompressions, multiple levels of fusions. And also the endoscopic spine surgery has advanced even to cervical spine surgery. We can do decompressions, laminectomies in cervical spine as well using endoscopic spine surgery. And also the difficult to do cases, especially in open spine surgery, that is thoracic disc herniations or ossified ligamentum flavum, that is your spinal canal is being narrowed in your mid back, which usually calls for complications in any kind of surgery. Using endoscopic spine surgery, we can do this job clearly, neatly, without any complications using endoscopic spine surgery. People think that spine surgery requires general anesthesia always. It is a myth, because in endoscopic spine surgery, we can perform even awake spine surgeries under local anesthesia or regional anesthesia. The patient can be fully awake, appreciate the surgeon performing the surgery, but is literally pain-free. Endoscopic spine surgery through a tiny hole, does it really last long? Is it really effective? Yes. Endoscopic spine surgery, though done through a small tiny hole, we have a panoramic view of the entire nerves, the bones, the compressing tissues around the nerves, and the disc. So we effectively clean everything using the small tiny hole with the camera and the endoscopic spine instruments, wherein we completely free the nerves 360 degrees. More importantly, endoscopic spine surgery offers little scarring inside the tissues as well. not only on the skin, even when compared to the traditional open surgeries, endoscopic spine surgery offers very little scarring involving the nerves when done through an endoscopic spine surgery. So you might ask, if it is so great, why isn't every spine surgeon doing it? Because endoscopic spine surgery, the learning curve is very high, and the cost of the equipment is also very high. Not everybody can afford the training, or not everybody can afford the equipment as well. Don't let the myths cloud your judgment. Full endoscopic spine surgery offers safe, effective and proven procedures for your spine problems. By bursting these myths, I hope you are now well informed about full endoscopic spine surgery. After all, knowledge is power, especially when you are making informed decisions about your health. To gain more knowledge about spine surgery and its advancements, please subscribe to our channel.